Ever wondered about some of the, well, stranger health issues our animals can face? Things that maybe don't seem obvious. Today, we're doing a deep dive into equine ocular squamous cell carcinoma. Quite a mouthful. We'll call it SEC. Basically, it's a really common skin cancer, but it hits horses right in the eye area. We've gathered a whole bunch of research, some really comprehensive guides, and our plan is to sift through it all. We want to pull out the absolute must-know info, the key takeaways, maybe some surprising bits so you get a real handle on it quickly. So, whether you own horses, just love them, or find animal health fascinating, this should give you a solid understanding. Okay, let's unpack this.
Right. So equine ocular SCC, it is, as you said, the most common tumor we see affecting a horse's eye and, the tissues right around it. It's a malignant tumor, which means it can grow aggressively.
Okay.
And it starts in the epithelial cells. Those are the cell's lining surfaces, like skin or the inside of the eyelid.
Okay, so it starts on the surface layers. And how aggressive are we talking? Does it spread like wildfire?
Well, that's a key point. It is malignant, but it's typically locally invasive, meaning it really likes to spread into the tissues nearby, right there around the eye. But importantly, metastasis that's spreading to, say, the lungs or liver is actually less common with this type of SCC compared to SCC elsewhere on the body.
Ah, okay. So it's more of a local invader, initially at least. That's interesting.
Yeah, its initial focus is often really contained to that eye region.
So why? Why do horses get this? Is there one main culprit, or is it a mix of things?
Oh, it's definitely multifactorial. The sources we looked at point to several key factors, and yeah, some might surprise you.
Lay it on me. What's factor number one?
Number one, hands down, is chronic UV radiation exposure. Sunlight.
Okay, like us getting too much sun.
Exactly like that. Think long-term exposure, especially to UVB rays. Over time, it causes cumulative DNA damage in those surface cells around the eye. This damage builds up, and eventually, it can lead to those cells becoming cancerous. There's even a specific gene, the P53 tumor suppressor gene.
The one that's supposed to stop cancer.
Right. That gene is often altered, basically taking away a key defense mechanism against tumor growth.
Wow. So the sun literally damages their defenses over time. That makes the pigmentation link make more sense then.
Precisely. That leads straight into the next big factor, lack of pigment. Horses with pink skin around the eyes, unpigmented eyelids, third eyelids, or even sometimes parts of the cornea itself, they're much more likely to get it. Melanin, the pigment, is like natural sunscreen. Without it, those tissues are just way more vulnerable to that UV damage.
So this isn't just about coat color overall, but specifically around the eyes. Does that mean certain breeds are just unlucky?
That's exactly it, which brings us to breed predisposition. And yeah, it gets specific. Draft breeds like Belgians and Clydesdales, especially if they have a lot of white on their face, that chrome.
So a flashy white marking isn't just pretty, it's a potential risk zone.
It can be, yes. Appaloosas, too, they often have less pigment in the white part of the eye, the sclera. Paints, pintos with big white face markings, ponies sometimes, even gray horses if they have a lot of white on the face. They're all more susceptible.
And on the flip side?
Well, breeds like Arabians, thoroughbreds, quarter horses, they tend to have a lower prevalence. It really points towards some kind of heritable component, even if we haven't nailed down the exact genes yet.
Okay, so UV, lack of pigment, breed. What else is in the mix?
Chronic irritation or inflammation can be a cofactor. Think long-term dust exposure,
Yeah.
allergies, maybe recurrent conjunctivitis, pink eye that keeps coming back, or other chronic inflammation on the cornea. It doesn't cause the cancer, but it seems to make the tissues more vulnerable to the UV damage.
Like weakening the defenses first.
Kind of, yeah. Age also plays a role. Older horses, usually around 10 years or older, are more commonly affected. That's likely due to that cumulative UV exposure over their lifetime.
Makes sense. More years, more sun.
And finally, where the horse lives matters. Geography. There's a higher prevalence in areas with higher altitude, longitude, or just more intense annual solar radiation. It really underlines how much the environment plays a part.
Right. So, okay, if you have a horse with these risk factors, maybe an Appaloosa with pink skin around the eye living in a sunny place, where exactly on the eye should you be looking most closely?
Good question. It can pop up in a few places, but the most common primary site, interestingly, is the third eyelid, the nictitating membrane.
Really? Not the main eyelid. That's kind of hidden away usually.
Yeah, it surprises people. But it gets a lot of UV exposure and often lacks pigment. Other common spots are the eyelids themselves, especially the lower one, the cornea, that clear front part, the conjunctiva, which is the pink lining, and the limbus.
The limbus, that's the edge where the clear part meets the white part.
Exactly, that junction. Less often, you might see it involving the tear ducts or the skin right next to the eye.
Okay, so what signs are we actually looking for? What does it look like when it starts? Is it obvious?
It can be really variable. That's part of the challenge. But the absolute key is looking for any lesion that just doesn't heal and seems to be changing or growing over time. Early on, it might be really subtle, maybe just a small, slightly raised pink or reddish area, like a little plaque or nodule. Sometimes it looks kind of irregular or granular, almost like cauliflower in texture. Or it might just look like persistent pink eye, redness, discharge, irritation that doesn't clear up with the usual treatments.
Ah, so it can masquerade as something less serious initially. That sounds tricky for owners if something looks like pink eye but just isn't getting better.
That's a huge red flag.
Yeah.
That's when you need to think, could this be something else?
Mm-hmm.
And get the vet involved.
What happens if it's ignored at that stage?
Well, as it progresses, the lesion gets bigger, more invasive. It often starts to ulcerate, break open, which leads to bleeding, crusting, and makes it prone to secondary infections.
Mm.
You'll likely see more obvious discharge, could be thick, pus-like, even bloody. The warts might start showing discomfort, like squinting a lot, or being really sensitive to bright light photophobia, we call it.
And on the cornea itself?
On the cornea, it might look like a fleshy pink mass with blood vessels growing into it, or maybe an opaque, cloudy raised spot.
Mm.
It can definitely start to block vision. In really advanced cases, it can actually destroy the eyelid, grow back into the eye socket, block tear ducts, invade deeper structures. It's usually just one eye, but sometimes you do see it in both.
Okay, that paints a pretty clear picture. Definitely needs prompt vet attention. So how do vets nail the diagnosis? What's the definitive test?
Yeah, getting an early, accurate diagnosis is absolutely critical for the best outcome. A good vet exam, looking closely, maybe using a fluorescein stain to check the cornea, that's the start. But the gold standard, the way to be absolutely sure, is a biopsy and histopathology.
Meaning taking a small piece of the suspicious tissue.
Exactly. Either a small piece, an incisional biopsy, or sometimes, if it's small enough, removing the whole thing, an excisional biopsy.
No.
That tissue goes to a veterinary pathologist who looks at it under the microscope. That confirms if it is SCC and can tell us how aggressive it looks, whether the edges of the removed tissue are clean.
So scraping some cells off isn't enough.
Cytology, the cell scraping, can sometimes give a clue, a preliminary idea, but it's much less reliable than looking at the actual tissue structure in a biopsy. And if the tumor looks big or like it might be invading deeper,
Then you need pictures.
right, imaging becomes really important for staging, figuring out exactly how far it's spread. That could be an ultrasound of the eye itself to see how deep the tumor goes, or for potentially deeper invasion, maybe CT or MRI scans to check for bone involvement or spread into the orbit, or to check the nearby lymph nodes.
Checking if it's starting to spread beyond the eye area.
Exactly. Sometimes the vet will feel the lymph nodes under the jaw or near the ear, or even biopsy them to check for metastasis.
Okay, so once you have that diagnosis confirmed, what's next? Treatment options. Is it usually just one thing or?
It really depends on the specifics of the tumor size, where exactly it is, how invasive it looks. But very often, a multimodal approach is best, using a combination of therapies.
Hitting it from different angles.
Precisely. Surgical excision cutting it out is often the first step, especially for smaller, localized lesions. The goal is always wide, clean margins, getting all the cancer cells. Depending on the location and size, this could be anything from a small procedure on the third eyelid to, in severe cases, removing the entire eye that's a nucleation. Sometimes a CO2 laser or cryosurgery is used, along with the scalpel.
Cryosurgery, freezing it.
Yeah, cryotherapy. It's effective for small, superficial lesions and often used right after surgery. They freeze the area rapidly, let it thaw, then freeze it again, maybe a couple of cycles. It helps kill any microscopic cancer cells left behind.
Okay, surgery, freezing, what else?
Then there's local chemotherapy. And this is really interesting because it's so targeted. You might use topical creams like 5-fluorouracil or 5-FU for very superficial stuff. More commonly, though, we use intralesional chemotherapy. That means injecting chemodrugs like cisplatin, often formulated into tiny beads, or a solution directly into the tumor itself.
Right into the cancer.
Exactly. It delivers a really high concentration of the drug right where it's needed, minimizing side effects elsewhere in the body. It can be very effective, often done after surgically removing the bulk of the tumor first.
But the owner has to stick with it.
Oh, absolutely. Owner commitment for the full course, which might be several treatments, is critical. Stopping early can unfortunately lead to the tumor becoming resistant.
Makes sense. Any other big guns?
Radiation therapy is an option, usually for larger tumors that can't be completely removed surgically, or if they come back, it can be curative sometimes, or at least shrink the tumor. But It's expensive and needs specialized facilities. There's a type called beta irradiation using strontium-90 that works really well for SCC on the cornea and limbus.
And I think I saw mention of immunotherapy.
Yeah, it's still a bit more limited, but things like BCG injections, which stimulate the immune system locally, have shown some success, particularly for tumors around the eye, not directly on it. Photodynamic therapy is another one showing promise.
Plus just keeping the horse comfortable, right?
Definitely. Supportive care is key. Pain relief with NSAIDs, antibiotics if there's infection, soothing eye drops or ointments, all part of the plan.
So that's quite the toolkit. Thinking about recurrence, which you mentioned is common, and the UV link, prevention seems huge here, especially long-term. What's the absolute best thing owners can do?
You nailed it. The single most important thing for long-term management and prevention in susceptible horses is UV protection. Especially after treatment, but really for any predisposed horse, you've got to minimize that UV exposure to the eyes. That primarily means using fly masks that offer high UV protection. Look for ones that block 80%, 90%, or even more of UV rays. Consistency is key.
And keeping them inside during peak sun.
Yes, for high-risk horses, considering stall confinement during the brightest part of the day, say from 10 a.m. to 4 p.m., can make a significant difference.
That sounds simple, but keeping a mask on a horse reliably or stalling them, that can be a management challenge for owners, can't it? Are there workarounds?
It definitely requires diligence, you're right. Masks get lost, get ripped, horses find ways to take them off. Inconsistency is probably the biggest pitfall. While full-time protection is the ideal, even just ensuring the mask is on during those peak midday hours is a huge help. If a horse just won't tolerate a mask, some owners resort to applying veterinary-approved sunscreens like zinc oxide creams around the unpigmented areas, but that needs very frequent reapplication multiple times a day to be effective.
Okay, so diligence is key. With all that in mind, the treatments, the prevention, what's the overall outlook? If a horse gets diagnosed with ocular SCC, what's the prognosis generally like?
Generally, it's considered good to guarded.
Right.
But it really depends on those factors we talked about. Where the tumor is, how big it is when caught, how invasive it is, and how completely it's treated.
So catching it small makes a massive difference.
Absolutely massive. Early diagnosis and aggressive treatment of small superficial lesions, especially if you get clean margins with surgery and maybe add cryo or chemo. Excellent prognosis for controlling it locally.
And location really matters too, you said.
Hugely. Tumors on the third eyelid often have the best prognosis. Why? Because they're usually pretty accessible for complete surgical removal. Eyelid tumors also do well if caught early. But tumors right on the cornea or the limbus, they're much trickier to treat without potentially affecting vision.
And the worst case scenario location-wise?
If the tumor has invaded deep into the orbit, the eye socket, that carries a guarded to poor prognosis. Complete removal is really difficult then. Recurrence is almost guaranteed, and often removing the entire eye in nucleation becomes the necessary choice for comfort and preventing further spread.
And that recurrence risk is always looming, isn't it?
It is. SCC is, well, notorious for coming back locally. Recurrence rates are estimated somewhere between 25% and maybe 42%, especially if the first removal wasn't complete or if the horse keeps getting significant UV exposure without protection.
Does it often spread far beyond the eye?
Metastasis is less common than local recurrence, thankfully. But it does happen in maybe 10–15% of cases, usually the really advanced, large, or recurrent ones. If it spreads to lymph nodes or organs like the lungs, the prognosis gets much worse. But again, that consistent UV protection we keep mentioning, it genuinely improves the long-term outlook significantly by helping prevent those recurrences or new tumors from forming. So yeah, vigilance and being proactive are just absolutely crucial.
Wow. We have really covered a lot of ground today, breaking down equine ocular SCC from, the complex causes the sun, the genetics, right through to all those different treatment strategies.
Yeah, and I think the biggest takeaway for you listening has to be that critical link between sunlight, UV radiation, and the horse's pigmentation or lack thereof around the eye. And knowing that catching it early, combining treatments effectively, and sticking with that UV protection afterwards, it just makes a world of difference for the horse's outcome.
So bottom line, any sore or spot around a horse's eye that isn't healing or any weird discharge that lingers, don't wait. Get it checked by your vet, seriously.
Absolutely. And zooming out, it really highlights this constant dance between genetics, the environment the animal lives in, and our role or responsibility in protecting them.
So as you think about all this, what really stands out to you? Maybe it's how something as simple as a fly mask becomes a powerful medical tool. Or maybe the incredible precision of injecting chemo right into a tiny tumor. Hopefully this deep dive gives you a really solid foundation to keep thinking about and exploring the honestly fascinating world of equine health.